Hello, everyone, and thank you so much for joining me for today's lecture. Today, we are going to look into the website for our course, Health Economics. Now, what has changed, of course, in the course website? The main change is that a piece of artificial intelligence has also been added to this course. It means that uh, you're going to have a tutor 24 over 7 per week. And then if you have any questions related to the course materials, obviously, you will be able to, again, open the application that is called My Tutor. I'm going to show this to you. And then you will be able to ask for your questions. Your question, I would say, first is that why having this if we already have all of the LLMs or all of the generative artificial intelligence applications online? The change is that since the education is evolving and we are really sitting on the wave and we are again adapting while it's evolving, we also have to take into account that uh, we have so much content that need to be managed. However, it's impossible, especially on internet. So what institutions, of course, like our institution, are doing is that we planned to use the same technology, obviously, but to control, or I would say to find the best materials that are, of course, solid, they are valid, and each professor is in charge of choosing the material. So nothing has changed between us for the use of AI. What has changed is the control for having the right materials for your courses. So for our course in health economics, this is what has been done as well. Of course, what I had to do was to select the material, prepare the materials, and then to submit them to the generative AI, which is here called My Tutor, and then to make sure that I am managing your learning by using valid sources. So this is the difference between what we have here in this course website and any AI application that you can see online. Okay, so now that I gave you this introduction, let's go over the structure of your course website. And you're going to see that many things are much easier now to do. Especially, I also had to program to code for several types of recapitulation of the materials. You will also see several weekly quizzes that will allow you, of course, to review the terms and the keywords. You also have case studies where these are self-studies where you can explore exactly what are the issues, what are the questions, what are the limitations for budgeting, for services when we are in the field of health economics. That's because if you would like to know more about, okay, what are the jobs out there for health economics, let me first start by telling you why you are in this course. Okay, so here we are looking into the key sectors and career opportunities for people who have the knowledge of health economics. So people including yourselves. Now, what is again health economics? This is just a science of managing the budget and managing the resources that we have in order to offer healthcare related products and services. So here we talk about a population, we talk about the population need, we talk about population's health, we talk about budgeting, and we are talking about different ways that different organizations, as well as governments, are going to write policies in order to manage, first of all, allocate and then manage some budget for health economics activities. This is why you will see wherever we are dealing with healthcare services or products where we need to have a budget, we will have people with the knowledge of health economics. So through this course, not only you will need to learn about the terminologies that we use to be able to communicate with different levels of people with different responsibilities in the field, but also you're going to learn about, again, budgeting for health services, reasons for having health services, what are the challenges that we have in Canada for health economics. And you're going to understand much better, much more why several decisions have been made by the government. Or, of course, governments, I'm talking about the federal and provincial governments and territorial governments because they do have their own healthcare system in hand as well, and they control it. So when you look into where you can apply for jobs or where you can just use your knowledge, you will see that, first of all, here in this table, you have the government and public sector. So what they do is that they're looking into data. They're looking into trends. They're looking into epidemiological findings. And then they are going to assign budgets. And then they are going to now review if the budget that was assigned was used properly and if they have been a return on investment. You know, when you are in a bank, for example, you are going to invest, for example, and then you are going to get something in return. Here, of course, we talk about money that you invest and money that you can have as a return. But in health economics, we are not talking only about money. We're also looking into other factors. And in order to look into those other factors like satisfaction, like life expectancy, for example, we have to also go over surveys. So this is where we talk about research analysis, analytics, and we are talking about numbers. Now we are going to try to reach to the populations, different populations with different conditions, different health status, for example, in different areas in Canada. And then we are going to conduct surveys as well. So when we are assigning budgets, we are going to again provide services and products now to different institutions, different ways that we are going to offer healthcare related services and products. And then we are also going to look into the return on investment. How we do that? We may just look into the patient's satisfaction survey. We look into the expenditures. We're going to see, for example, if we are paying for a vaccine that is coming and is paid by, again, provincial governments in their provinces. Now we're going to look into any prevention thanks to the use of the vaccine in the next few years. And we are then going to calculate with the data that we have, and if we don't, we will just have the surveys or do the studies. We're going to see if the investment was useful for the society, for us. So you may invest $10 million in a vaccination campaign, and you look into the return on investment in the society 2-3 years later to see if we see, in fact, some reduction in the number of cases of a disease for which we already introduced a vaccine into the market 3-4 years ago, and the vaccine was already reimbursed by the provincial government, for example. Now you understand that each and every decision for offering health services should be based on very meticulous study, looking into the cost, looking into the logistics, looking into the operations of what we do, and then looking into the effect of the service that we are offering to the population, as well as managing again, not just the cost, but also the benefits of that service to the society, and obviously to look into the return on investment, ROI, because if a project or a decision is useful, we continue to build on that and improve it. If not, we have to change it. So here we see another topic of discussion, which is about policies. Why we talk about policies? Like any other ministries, okay, Ministry of Health has also policies. We have to invest in different healthcare related products and services. Now it can be through the again public sector, it can be through the private sector. So here you see on the left column the public sector, the government and public sector. And then the second line is about pharmaceuticals and biotechnologies, the companies. So here you see that we're talking about the private sector as well. But you can also look into healthcare providers and insurance. So it's a mixture of private and public, semi-public structures. You can also use your knowledge in health economics, working in consulting firms. And again, what they do is that, as you can see, providing expert advice on economic modeling, policy assessment, and strategic planning for clients in healthcare. But overall, what does it mean? It means that by having your knowledge in health economics, you're going to be able to look into the society, looking into the needs, looking into the trends. And if we don't have enough data, even to create surveys and doing some research in order to get enough data, in order to facilitate, to allow institutions to make decisions, institutions and governments to write policies that will allow us to decide how the best way we can invest in the healthcare sector so that the population is going to benefit. However, we have to monitor the operations, we have to monitor the outcomes, and we need to update the policies as well. Now, if you're in a pharmaceutical company, obviously you may not write those policies, obviously, but what you do is that you are going to, again, use the health economics, all of the dynamics, all of those policies in order to shape the launch of a drug, of a medical device. So this knowledge allows pharmaceutical companies to write or to introduce their new products into the formulary listing in each province, to be able to talk and to negotiate with insurances and with governments that pay for those products and services as well. Because don't forget, we are in Canada. So it's one of the best healthcare systems in the world compared to other countries. So that's how we keep our healthcare system up and running, and we optimize it through health economics. We have people like you are going to look into, again, the expenditures, looking into the needs of the society, looking into the cost of different services, and they are going to make policies or making decisions in order to manage the way that we are investing and we are expensing for giving those healthcare services and products. So now that you understood what is health economics and why, again, we are in this course, and again, you also understand where you can apply for jobs. Now I'm going to go over the content of the website. So when you go to the website, obviously, the first link is to join me every week if you have any questions. And then we'll be able to have discussions as well. But the main thing is that instead of you listening to me for 3 hours in a row, which is something, again, that doesn't happen, okay, it's not very easy to stay for 3 hours and to, again, listen to someone, okay, even if it's very important and interesting. You have all of the recorded video lectures available from this website as well. And I'm going to cover that. You also have several case scenarios where you will be able to discover on your own time because you need to have a flexible time. It's easier to understand and to, of course, learn. For example, for the terminologies, you cannot just have 600 words, knowing about those by heart in 2 hours. It has to be done gradually. And the way that um, again, the course is designed and the way that I made the materials is that each day, each week, I would say, you will be exposed to new set of terminologies and case scenarios. So you're going to um, increase your knowledge step by step every week. And more you know about terminologies, easier will be for you to communicate, then to read the materials, then to understand the materials. And then the next lecture is going to build up on your knowledge and on your vision. So it's not just a matter of passing the course, it's a matter of developing your mindset, developing your vision, learning about new terminologies so that you are able to communicate, to understand the needs, to also explain or communicate the trends, and then also to even propose, obviously, the best solutions. So that's why the course has been, again, developed. And of course, each time I keep that up to date uh, for this purpose. Okay, so the next section that you're going to see is about the course information when you have the course syllabus. So for those who would like to continue with a master's degree, with a PhD, or maybe to go to another bachelor's degree or any graduate certificate, you may want to ask for some equivalencies for the courses that already exist in the new program that you are looking into starting. In this case, you may want to ask for a transfer of the credit, and you need to have the syllabus of the courses that you did take already. So I'm encouraging everyone to save this syllabus and to keep it in your files because you may want to later use it as a tool to say that you already covered the materials. So it becomes handy. Then you have the faculty contact information. This is my contact information. Don't hesitate to contact me if there is any question, if anything is not clear. I will be at your disposal, as you know, as always, because we are learning together. Don't forget that for making the materials of this course, each time I redo everything, I check everything. So thanks to you, I have to update my knowledge. Okay, of course I do it all the time, but this is a specific knowledge. So I am learning with you as well. When I am also reading your work, if you have some assignments, I'm learning from you as well, my friends. Okay, you have always good ideas, new critiques that are always useful. It allows me to develop my critical skills, critical thinking skills as well. And I hope that you have the same thing as well. You have the same advantages when you come to these courses and you are learning the materials that I prepared based on, of course, the valid sources. So it's really a win-win situation, and that's why I'm so happy. And that's why I am available to you. So let me know if there is any issue, if there is anything, obviously, about the course materials as well. I will be at your disposal with great pleasure. Then we have to go over the generative AI because you may not know this, so you may, but we started to look into chatbots in the year 2005, 2006, and those chatbots, of course, were very limited, and the use was based on again having a computer program where it would just get your input with text. The text would be saved in a file. The file would be indexed. And then when you were using the same interface on the web page, asking for something, that program would create sentences based on your primary input that was memorized and saved in a text file in the same folder of that application. That was it. And then we had more and more of the chatbots using HTML. Then it switched, of course, it was evolved and it went to servers. And obviously, we ended up by evolving, I would say, every month, every day. So that now we are at a level where we have the generative AI that is doing a very similar thing, but of course the processors are much faster. We have also added algorithms, and we can now also use not only text, but other ways of communication that we use on internet and the books as well. So as long as you have any document which is in electronic format, such as a video, a picture, a PDF, a Word document, any type of document which is digitalized, it can now be processed and analyzed by those different algorithms that we use in the artificial intelligence applications. Now, don't mix up automation and artificial intelligence. Artificial intelligence allows us to do automations of different processes, meaning that automation is going to be connected to some robots, to some robots as well. But I don't think that as soon as I say robots, these are companion robots, okay, or robots that are resembling to men or women. But what I'm saying is that it's going to be connected to robots, meaning machines that are already having pre-programmed functions or movements or actions. And again, through the automations, we will be able to give them different codes and then to see those machines working. We had the automation even at the beginning of the 19th century with pianos. I'm sure you saw those pianos where we were just putting a piece of paper with different holes on it, like a code, and the code was being read, and the piano was playing a specific, I would say, sequence of notes. So that's automation. But AI is much bigger because this is processes, these are algorithms, and it is learning. So from your input as well, and then it is giving you the outputs, but we control the outputs. And we, of course, through the pre-programmed algorithms or pre-written algorithms, we can use the AI. Now, why I said that, that's because we also use AI or generative AI for learning, for writing. Nowadays, you can just write, again, a thesis, a draft of a thesis that it would take maybe 2 or 3 months to write in maybe 20 minutes, 10 minutes. But of course, the AI gives you a draft, about 50, 60% of the work that was a routine thing. It's okay. But the remaining, we have to work on that. Now, the challenge that we had is that many people think, still now are thinking that AI is going to give them the full product, which is not the case. It just gives drafts. It can never be the final product because you know more about human interactions, about the use, about the needs, about ideas. AIs, they don't create ideas. They just repeat ideas that you may not have heard about in your own environment. So they have access to other environments through internet again, or through documents that we put in their memory and they can analyze, but they cannot go beyond what has been already published or written. So creativity is there for humans. You also have ethics. Don't forget that when you're using generative AI, it doesn't, uh, again, take into account the ethics. Ethics meaning the set of moral values that may be, again, personal, but we also have societal or community ethics as well. So when you're talking about generative AI, we are talking about a tool. It's like having someone who has a car, but when you sit in the car doesn't bring you somewhere. You tell to the car where to go. So the car is a tool and you decide, okay, with your creativity, critical thinking and ethics. And this is why all of the institutions are repeating the fact that generative AI is just a tool, but it can make mistakes. It is not always ethical. We also have the issue of copyrighted materials that we have to respect. So this is why, again, in any institutions, we are still, again, hesitating to introduce that. For me, again, I was working even with chatbots. I was programming those chatbots just for my entertainment in 2008, 9, for example. And I was looking into the evolution. So use it, use the tool AI. It allows you to have a draft, but you have to work on the draft. Even for your tests, for example, you can copy and paste the text, and then to get a result from the AI. But I can tell you, it doesn't help. I can tell you that because for the last 4 or 5 years, I was observing again the evolution of AI and then also the marks in my courses. And I can tell you that even after the I have about 4 or 5% drop in the results of the exams. That's because uh, I have to explain to students, to my friends, to my colleagues, all of you, that again, you can use AI. You can even copy and paste the test or your test exam. It's okay. You can say put it on a in chat GPT. It will explain the question for you. It's perfect. But then if it gives you the answer, you have to think twice. Okay. And this is where, to me, as an educator, this is great because I have to persuade my students to not to just copy and paste, but that they can use a tool that is going to stimulate more your senses for searching, because now you have doubt on what it says. Now you have to do more search, and just spending the time to do more search is learning as well. Now you understand why I adopted this the My Tutor tool right away, and it's lovely. Even you can use it. I'm going to show you just to do your assignments. But again, this is not perfect, okay? But it's a tool for pushing you to think, and by thinking and working with these different terminologies, you are learning. Now you see why I'm happy that we are using the technology for that. Okay, so for the remaining, this is about the academic integrity. I never had any issue with any of my students for last 30 years, I think, about again plagiarism. Okay, these things should not happen. We are here to learn. So I leave it to you to go over this as well, in order to obviously learn, not by copying others, you don't learn, but learn by, again, doing your own search, because then you can really learn a lot and apply your knowledge as well. Okay, now what I did as well is that I prepared again all of the video lectures for you. Now, some of them are 25 minutes, okay? Some of them go to up to 40, 30 minutes, but these are all coming from the PowerPoints that I presented. Of course, I also changed the voice so that everyone would be able to listen. We have students who may have some, I would say, challenges for the intonations used. So I made sure that the voice, the pitch, of course, of the voice is also optimized for everyone. All of those videos, they also have transcripts. You need just to activate the transcript. If you would like to, again, listen to this in another language, you can also do that. It depends, of course, on your YouTube application. So I don't go more into details. This is YouTube. But you have now all of the tools that you need. Now, in these lectures, they are not 3, 4 hours of lecture, because I wanted to make sure that you do get exactly what you need for each chapter. It's not a matter of giving you exactly 2 hours of lecture. It's a matter of transferring the knowledge, transferring, of course, the understanding. And it doesn't need to be 6 hours. Okay. So you don't even need to watch the video. You can just listen to that as well. Okay. If you're on the bus, if you're driving, you can just open it. You're going to get used, of course, to the voice, and then you will be able now to just grab the information, uh, of course, by watching and or of course listening to the content of those presentations. Now, after this, I also, as I told you, you have my tutor for this course. So this is an artificial intelligence tool where I added all of the information, the content not copyrighted, obvious, this is my content. And I added those into the memory of this generative AI. It processed the text and the content. And even I can tell you, it also processed the YouTube videos that I shared with you as well, because I shared the videos with it as well. Now the program did index everything. And now when you're going to, again, look at the content, let me see, it's not here. Okay, perfect. This is the interface. So when you are going to click on my tutor here on the left side on the course website, you are going to see this interface. Now I have 3 courses. I will have very soon 4 courses, but the course that you have yours for today is this one. So when you click, it's going to open like any online LLM or generative AI. You will see a window with all of your answers, and at the bottom you have a text box in order to write your question. Again, you may say it's very primitive. It is. And obviously, for sure, we are going to see in the next years, again, another function so that it's going to read. You can also be able to talk with it. And obviously, we may also have an avatar of me one day. Okay, I already have that, but not in this interface because it's really, again, this is just a first step, but it's going to evolve. So what I did for you was, again, the fact that I wrote, again, my question, and I said, okay, what is health economics? And then I got this answer. Now, you may ask some answers where it may not exist in the content that I did put here. Okay, so the program, this AI, is going to tell you there is no answer available. So no worries. What I did is that I did add the content that you needed for this course, and everything is already there. So if you don't find anything here, you can always go on internet. But again, that knowledge that you're going to acquire is not part of the content that I'm teaching here because I did not verify that, or it was not coming from a valid source, or you may not ask, for example, in this interface to do your assignments. That's why. So use it. Get used to that. Okay, if you would like to have access to an AI that is just helping you as a tutor, not going outside of the content of the course. But if you would like, of course, to expand your horizons, my friends, do it. Okay, go to other AI applications. But again, keep in mind that the content is not controlled in a way that it's not selected. So the best content has not been selected. But again, be my guest. Of course, do it. I mean, I cannot stop anyone from learning and from expanding his or her horizons. But I have to just talk about this AI that the college did add into the servers, and we use them now. Perfect. Then I gave you health economics case scenarios. So this is for your self-study. I already made several scenarios, not just one, but in the one you are going to do several other set scenarios where you are a minister of health. You are an administrator, you are a head of a pharmacy, you are a head of a hospital. And then I created some case scenarios. Of course, I had to code them, and I'm going to open one of those for you. So when you have this opened, it's going to show you this website. Okay, this is again what I coded within your course. So I mean, it's I'm not saying copyrighted. It's not a question of copyright. This is original content. So this is not done by anyone else. It's done by me. So now you can start, of course, read about the health economics. Please take the time to read. I didn't add too many information. Whatever you need just to initiate the learning by understanding what health economics does, what again the decision maker does, and then you can also look into the real data that is proposed, that is shown here specifically for Canada, and then you can start your scenario. Now you click. Now you need to read, okay? I could have put, of course, a voice. I may, okay, I will try, but when I put a voice into this, so it's going to read for you the content, the setting for the voice in your computer or desktop may not be the same. So here I cannot control it through this interface. That's why you don't have the voice. But still, if you would like to listen that, you know that you have a function in your desktop, in your computers that can read the content as well. Okay. So now continuing with this, you can now look into the case, and then you're going to see what are the possibilities for this case. So you're a Minister of Health, and you're facing a critical decision, and you are looking into the provincial budget that is now decreased or increased, and you have to make a decision. So you have to think about expanding hospital capacity or invest in rural telehealth. Okay, so now you are going to, like a Minister of Health in Ontario, you are going to learn more. So you can click on expanding hospital capacity case. You're going to read about that. Okay, and now you are going to look into the cost analysis about the outcomes, and then you're going to see what is the best solution. But not now, go back to the scenarios. Open also the scenario for investing in rural areas, and then look into again the investments, operating costs, etc. And then look into the best solution. And again, this is just one case scenario that it will allow you to think. It's not long. It would take 10, 15, 10, I would say 10, 15 minutes for you to learn about that. But this is the application of what you learn. So you have a very similar but not identical against say health economics case scenarios. So you have scenarios for number 2, 3, and 4. If you think that you would like to have more scenarios, let me know. I will have to code it. It's not available online or anywhere else. So I will do that for you with pleasure. But I think that even the 4 already here, they already cover the course materials as well. So after talking about the case scenarios, you also have the lecture notes. First, you may say, but what we are going to really learn this semester? Usually, students, they look into the course outcomes. There is a table, and they are going to see what materials or what, I would say, titles they are going to cover, but it's not sufficient. So again, what I did is that I created for you a recapitulation program. Again, I coded that for you again with the materials covered. So if you would like to know what you will cover exactly, and you can just follow your pace and understand where you are during the semester, you can click on this recapitulation table, and it will tell you, of course, what you are learning, okay? And if they will tell you also based on which slide what you are learning. So you can click on definitions of health and healthcare, and you can now read the content of the relevant slide for that topic. Now, this is done for, of course, each and every of your lecture notes. And in order to know overall what you have learned, this is like the course outcomes, you can refer to this recapitulation table. Now, for the slides, you do have the slides that are prepared already. I'm just waiting this to show up. So when you are looking into the slides, this is again shown this way. But if you save the slide and open it on your desktop or your laptop, you also have speaker's note for each slide. And those speaker's notes are also there in order to give you much more information related to each slide. So I repeat again, if you would like to access the speaker's note that explain much more what is on each slide, like a lecture, you have to save this PowerPoint presentation, and you will need to just open the PowerPoint and look into the speaker's note. I did my best, as you see, in order to give you the full information. The speaker's note is not just copy and pasting of the book, of course not. I used not just one book, not several books, but as many sources, valid sources that I could find on internet, including my own knowledge and experience, but mainly, of course, using citations that I always, of course, wrote the source. And again, the material that you get here is the up-to-date material, especially for the Canadian setting, because we don't have too many books on the health economics for Canada. The number is limited, and I didn't want to limit our knowledge to only one book. That's why. Perfect. And then once we are done with the course notes, we are now looking into the exams and quizzes. So for the exams and quizzes, you are invited, of course, to go over the weekly quizzes. You have the due dates, and when you are opening those weekly quizzes, of course, they are going to show you again, the information. This is directly related to, again, the chapters of that week. So you can, again, open your chapters on the week on one side of your screen. You can open the weekly quiz on the other side. You can search for that question. You can also search for the answer on internet. This is an open book exam. But again, don't forget, the aim is not just to copy and paste. The aim is to search. That's why you have unlimited time for these quizzes. So it's really designed and made in order for you to search, because by searching, you will learn much more. And then by going through the case scenarios, you are going to apply your knowledge. It's also a way of gamification. Okay, that's why you cannot just do that in one, I would say, class over 2 hours or 3 hours. It must be done over time, and you need, of course, to be able to absorb and to learn and to, of course, memorize sometimes those key terms. And when you memorize and when you use them, you will then understand, and then you will be able to apply those. Perfect. And then you have different weekly quizzes. Please, again, go with the learning schedule that is already embedded here. So you can just come here and look at the exams and quizzes. You also have your midterm. Okay, so don't open that now, please, because you can only open that once. And then you're going to continue with completing your assignments. The aim is that we are making sure that the learning happened. And for you, you are testing yourself, your knowledge. And again, since you don't have, again, for not all, but many of those quizzes, you don't have any limited time. for the weekly quizzes. It's going to be, again, a very interesting learning, um, I would say, strategy for you. Okay, now the last thing that I would like to tell you is about articles. I'm sure that you have been in some of my classes where we did publications. Of course, the quality of your assignments are going to allow me to see if we can publish it or not in the National Library of Canada. And what we did so far is that in several of my classes, yes, we had several publications and our students did a very good job. They also added them into their LinkedIn profile. But it's not just that. When you're applying for a job, you're going to talk about what you have done, what you learned, but you also need some support in order to show that you can also apply your knowledge. You can come up with doing a literature search, explaining things, communicating with the right terms within that field of interest. And then you can also come up with recommendations because your brain or your knowledge was developed enough in order to understand, to do the analysis, to use data, to get the data, or to use existing data and again to come up with analysis and then to propose the best practices or to recommend to improve the way that we are resolving issues in a specific field. Now, coming back to what I was telling you, for this course as well, if you would like to, you can always choose one of these topics. These are the topics that are very, again, important for now. They're all related to Canada because we are in Canada. We do care about our country. We want to improve things in Canada. Even a small improvement can change so much and affects anyone. So please look into these topics. Now you can write again the article. I didn't give you a specific template. I just told you that you need to have these sections in your article. If you want to write one with me, of course, you will be the first author. I will be the second. Uh, you can write it in groups. I have no issue with this, of course not. But as long as you can write an article where you can show your knowledge, you can show you are documenting your ability to find the information and data, to deal with, again, the information, to analyze that from different sources, and then to come up with best practices or recommendations that will be used in the field of your study. So here we talk about health economics. So again, if you would like to write an article, just let me know. And I'm going to, if you want, I can send you a template. If not, just leave it this way. There's no issue. I just give this to you as a perk. I would say it's just for students who would like to go a little bit beyond the boundaries of the course. That's why. So I didn't want to limit you just to the course materials. So that was, again, the explanation of the course website for this year. I hope that you're going to be able to go over the content every week, look into the case scenarios, watching the videos, completing your quizzes, and of course to come every week in order for us to be able to discuss further, because the learning will happen with the videos, lectures, with the quizzes, with again the lecture notes, and of course with the AI that we also added, the tutor or my tutor. But we still need to have those discussions. Okay, so I will be, of course, here every week, and we are going to be able to discuss further. So thank you so much for again your attention, and I will see you soon. Thank you. Mhm.